Smile, happy, yeah. Smile, happy, smiley face. Smile, happy, yeah.
Hey everyone, and welcome back to another episode of Clinical Research and Tea with Jet. I'm your host, Jet, and we've been focusing on men's health this week. And today we're going to be talking about a topic that often hides behind gym walls: anabolic steroid misuse. Let's talk about what steroids really do and why the risks outweigh the gains. Anabolic androgenic steroids, or AAS, are synthetic versions of testosterone. They're sometimes prescribed medically for conditions like delayed puberty or muscle loss from chronic disease. But misuse happens when men take them without prescriptions to increase muscle mass, improve performance, or enhance appearance. The DEA classifies them as a Schedule III controlled substance, meaning it's legal to use them without a prescription. Despite this, surveys show that hundreds of thousands of men, especially young athletes, misuse them every year. So steroid misuse impacts nearly every system in the body. Now, this includes the reproductive system. The long-term use can shrink testicles, reduce sperm production, and cause infertility. A 2021 Endocrine Society study showed some men experience irreversible testicular dysfunction after steroid abuse. Then there's the cardiovascular system. Steroids raise LDL cholesterol, increase blood pressure, and heighten the risk of heart attack and stroke. There's also liver damage. So the oral steroids are toxic to the liver, sometimes leading to tumors or cysts. And lastly, it affects brain and behaviors. So steroids can trigger mood swings and aggression, or what's often called roid rage, along with anxiety, paranoia, and even depression. And here's the kicker: stopping isn't easy. Misuse can cause dependence, withdrawal, and relapse, similar to patterns seen with other addictive substances. The harm from steroids isn't just physical, it's generational. Young men who use steroids often face long-term risks for fertility, hormonal balance, and even brain development. One review in Frontier in Endocrinology found that nearly 1 in 3 long-term users had lasting endocrine dysfunction even years after stopping. Men of color are also disproportionately impacted, with disparities in access to education, safe training environments, and healthcare support. Without proper medical guidance, misuse can spiral into lifelong health struggles. Well, we got some good news. Recovery is possible with medical support, counseling, and community resources. Awareness programs, safe sport initiatives, and honest conversations about body image and health can make a difference. The strongest men aren't the ones with the biggest muscles. They're the ones protecting their health for the long run. Steroids may offer quick results, but the hidden costs are far too high. This Men's Health Week, let's choose prevention, awareness, and safer paths to strength. Thanks for tuning in to Clinical Research and Tea with Jet. Stay healthy, stay strong, and I'll see you tomorrow as we continue Men's Health Week. And let's have a cup of tea together.
Smile, 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 smiley face. Have a nice day.